to separate it into different sections, but we're going to pick up on page 62 with Human Cancers by Organ Site, and we're going to start with lung cancer, which is slide 21 of your PowerPoint. Lung cancer, as you know, is a very, very deadly cancer. It's the most common malignant disease worldwide. Now, the reason why they say it's the most common malignant disease is because a lot of people may not develop lung cancer as their primary cancer. It may start somewhere else, like ovarian cancer, and usually the last place that it will spread is the lungs. So that's why they say it's the most malignant cancer in its lungs. In the U.S., an estimated 213,380 new cases were expected in 2007. And then, of course, the most common cause of lung cancer is smoking. Going on to the next slide. Most lung cancers, you're not going to develop symptoms. And then the ones that do may start as mild with maybe some coughing or coughing up phlegm. But once the cancer has advanced, the main symptom is shortness of breath. You may have blood in the sputum. Chest pain and loss of appetite are going to be the more advanced systems, and that means it's at the end stages. The two major types of lung cancer. The non-small cell lung cancer includes cellular types such as squamous cell carcinomas, and then you have your adenocarcinomas and your large cell tumors. And then to diagnose cancer, usually you can do a chest x-ray, MRI, CAT scan. The most common way to do it is with a sputum analysis or a biopsy. You can do that as well. You can also do a bronchoscopy, but the most common way to diagnose is going to be the sputum analysis and actually taking a piece of tissue from the lungs. Early stage tumors are treated with surgery. We can do radiation if it's an early stage. If it's not early stage, there's not really anything that we can do from there. And there's not really any surgery that we can do once it advances in after stage 1. So stages 2 through 4, there's not really a lot that we can do. Let's see. Using multiple chemotherapy agents is often provides better treatment outcomes than using just chemo or radiation by itself. But still, we can still have the cancer that it may come back. When it comes back, it may be even more severe. It is a preventable disease. Obviously, don't smoke. Don't be around secondhand smoke. Environmental factors, of course, can prevent 20 to 30 million deaths before 2025 and 150 million deaths before 2050. So those are some big numbers. Let's go on and talk about breast cancer on page 63. Breast cancer, is probably the most common cancer that you hear about commonly. It's the most frequently diagnosed cancer in women, and 1 million cases occur annually of breast cancer. Breast cancer, if caught early, is very treatable, but once it passes that certain stage, it can become deadly. So the earliest sign of breast cancer is obviously going to be a lump or a nodule in the breast. You may not even have that. The best thing to do is your monthly breast exams, and then of course a physician should examine your breast once a year at a well woman visit. But if you don't have a nodule or you can't feel any abnormalities, a mammogram will pick that up. And then of course, if a mammogram shows any kind of spots that we may be concerned with, then the physician will order a biopsy, and that's what ultimately tells us if we have breast cancer or not. Less common symptoms of breast cancer may include changes to the breast, like thickening of the skin or an orange peel appearance. We may have inverted nipple or nipple discharge, skin irritation, swelling in certain areas, You may have ulceration of the breast tissue or the nipple. So those are some common symptoms, but less common. Usually we just maybe have a mass and maybe a little tenderness. Age, female gender, and personal family history are the most important risk factors for breast cancer. But just a little tidbit on the side that's not in your book. With breast cancer, a lot of people think, well, if your mom has it, it puts you more at risk. And that's not true. If your aunt, which is a sister of your mother, has it, that puts you more at risk. So that's important to remember. A long menstrual history, using birth control pills will, both of those will contribute to breast cancer. Never having any children, actually, can contribute. Or having a first child after the age of 30 has also been linked to breast cancer. Something to do with the hormones. But I'm not really for sure about not ever having children, how that relates, but apparently it does. The diagnosis is made by assessment of the breast. Again, the physician will feel a nodule, or even you may just be having your regular mammogram and they see a spot and then they're going to biopsy it. Breast cancer screening has been associated with a 30% reduction in breast cancer mortality in populations. And then, of course, mammograms have been adopted now. Women may choose to have a mastectomy or double mastectomy to remove any kind of lymph nodes and all the breast tissue. So it's really up to the patient. And then, of course, you may have chemo and radiation with that. Let's see. You may also have some hormone therapy for the treatment of breast cancer as well. Of course, you can have combination therapy, which would be like surgery and chemotherapy, or surgery and radiation combined, to make sure that we're getting all of it. Then on slide 35, you have a video of a lady getting a breast exam. So that's actually a really good video to watch. It'll teach you how to properly do a breast exam. Then you have another video about a mammogram. And then you see a slide that shows you stomach cancer, which we're about to talk about. So let's go on to stomach cancer on the bottom of page 63. Stomach cancer is the 4th most common malignancy in the United States. And it is becoming less common. The most common cause of this is diet. Eating high-fat diets will cause this, or inadequate intake of fruits and vegetables. High salt intake will cause stomach cancer. And then any kind of smoked or cured stomach cancer being less common. There's a bacteria called the Helicobacter pylori virus. For short, we call that the H. pylori virus, and this causes peptic ulcers in the stomach. And usually when they say if you've ever had any kind of disease like H. pylori or irritable bowel syndrome, that puts you more at risk for any type of colon cancer or stomach cancer. Chronic gastritis, which is just inflammation of the gastric system. So all of these put you more at risk for stomach cancer. Early forms of stomach cancer are usually going to be asymptomatic, and you may even confuse some of the early signs like, pain, dysphagia, stuff like that. You may confuse that with just your normal gastritis, or if you have a, irritable bowel syndrome or something like that, you may confuse it with. Sometimes we'll get some fatigue, loss of energy, decrease in appetite as well, but generally no symptoms at all. So the definitive diagnosis for this is going to be done by taking a biopsy. That's the best way to do it. We can do a CAT scan or MRI to see if there's, to see the size and location and see if it's spread. But a biopsy is going to be your number one diagnostic tool here for not just stomach cancer, but all cancers. A biopsy is 100% will tell us if it's cancerous or not. Surgery is the best way to remove this cancer. It depends on the extent too. If it's covering your entire stomach, of course we wouldn't want to do surgery, but you may want to combine it with radiation therapy, or you may just have to do radiation therapy, especially if it can't be removed. If you look at slide 43, this shows you colon cancer, and you can see to the right, I wish I had a pointer where I could show you, but if you look at the right, this shows you where the cancer is, where the colon is not illuminating like it should. So let's go on to colorectal cancer. On page 64 at the bottom, colorectal cancer is carbohydrates, animal proteins combined with low exercise. These are all going to be most common people to have this. Slide 44, that it gives you the numbers, but of course you don't have to remember how many numbers of people got it every year. Going on to the next one, screening is necessary. So what would be the screening tool that you would use to screen for colorectal? Usually beginning at age 50, 55, you will start having a colonoscopy every 5 years, or there's also called a smaller procedure. Lord, my mind just went blank about the procedure, but into the transverse colon. But a colonoscopy will let the physician see all the way into the colon to see if there's any type of lesions or anything. As you get older, colon cancer you're going to get more at risk. More the people get older, over 50. That's why they set those rules for you to have a colonoscopy starting around that age every 5 years. And of course, if you're more at risk, we may do it more often than every 5 years. Let's see, risk factors include obesity, physical inactivity, like we said, smoking, heavy alcohol consumption will definitely cause colon cancer, diet high in red and processed meats, and inadequate intake of fruits and vegetables. Surgery is a curative for colorectal cancers that have not spread, but unfortunately, a lot of times we may not have known they spread until we start having symptoms, and then by then it's everywhere. So chemotherapy alone, we can do that, or we can do it in combination and have chemo or radiation, or we could do surgery, chemo, and radiation. Just depends on the physician how vigorously he or she wants to treat it. And then if you look at the next slide, on slide 49, it shows you a picture of cancer of the liver. So we're going to talk about that, and then we're going to stop this video so it doesn't go on too long. But that is cancer of the liver. So going on and talking about liver cancer on the bottom of page 65, this is a pretty bad cancer. It only accounts for 4% of the cancers in the nation or worldwide, and it also affects men more than women, so that's really important to know. Cancer will metastasize to the liver, usually before it will go to the lungs and the brain, so the liver is a common site of metastasis for cancer. Common symptoms of liver cancer: abdominal pain, weight loss, fatigue, abdominal swelling, anorexia. And by that I mean just loss of appetite and not being able to eat. Other signs, we may have impaired liver function, ascites, which is accumulation of fluid in the abdominal cavity, hepatomegaly, which is an enlarged liver, and jaundice, which is yellowing of the skin. Liver cancer follows a very rapid course, so you have to treat it really fast if we're going to treat it. We only have a 10% survival rate at 5 years right now, so that's not good. Majority of cases can be diagnosed with a CAT scan. Depends on the extent. You can do surgical removal of the tumors, and that may help. But of course, if it's spread, there's not a whole lot that we can do besides chemotherapy and radiation. and usually liver cancers are not very sensitive to chemotherapy at all. Radiation, we may use that to control some symptoms, but radiation will shrink the tumor, but radiation has side effects too. Liver transplant is an option, but you may be on the waiting list for a long time for that. Okay, so we are going to stop there for this lecture.